I'm Dr. George Anterasian. Today we're going to use the Fraxel Laser on Amanda to treat her hands and treat her chest. Amanda, over the course of her life, has had a lot of sun exposure. As a result, she has a fairly significant sun damage to her skin. If we look at her hands, which we're going to treat first, it's easy to see that there are significant textural changes in the skin, and there are also a lot of sunspots, which are a result of excessive sun exposure. We're going to use the Fraxel Laser to improve these. The Fraxel Laser utilizes fractional resurfacing technology to resurface the skin. The treatment is generally given as a series of treatments, usually around 4 or 5, at 3 to 4 week intervals. The laser utilizes fractional resurfacing technology. With fractional resurfacing technology, only a portion of the skin actually receives the laser light. This results in rapid healing following the procedure and essentially a zero downtime procedure. So let's get started. We're going to begin by applying a clear gel to the skin. The purpose of the clear gel is just to let the laser slide easily and smoothly over the skin. My nurse Gabby is going to hold a cold air blower at the area that I'm treating. The cold air supplements the anesthesia and makes the procedure more comfortable. Are you comfortable, Amanda?
How are you doing, Amanda?
That completes the second pass. I finished the first 2 passes on the left hand, and now I'm going to come to the right hand and start the right hand. When I treat the hands, I like to alternate between the two, doing first half of the treatment on one side and then half of the treatment on the other side, and going back and forth in that manner. I like to do it that way so that all of the energy does not go in at just one time, but is rather spread out. It's a more gentle way to do it. So I'm going to do 2 passes now on the right hand. Good. That finishes the second pass on the right hand. I'll go back to the left hand and we'll finish the treatment over there. I've returned now to the left hand. I'm going to do the last 2 passes on the left hand. I'm going to do at least one of these passes in a perpendicular direction. And the purpose of going in a perpendicular direction is to make sure that the treatment is nicely blended and is very evenly delivered. That completes the third pass, and I'll do a last pass in the same direction so that everything is uniform, nicely blended with a nice even treatment. Finish the final pass on Amanda's hands. If we look at her skin now, you can see it's slightly pink in color and very slightly puffy. We're going to put some ice on now to cool everything down. Then we'll put some sunscreen, and then we'll be done. Let that sit for about 10 or 15 minutes. We've finished the Fraxel Laser treatment on Amanda's hands, and now we're going to go onto her chest and do the Fraxel Laser resurfacing there. If we look at Amanda's chest, again we see the results of a history of fairly extensive sun exposure. There are a lot of sunspots on her skin. There are broken capillaries on the skin. There are also a lot of fine lines, textural changes, textural irregularities that are easily seen on the skin. The Fraxel Laser will improve the sunspots. It'll even out the coloring of her skin, and over a series of treatments will also improve the texture and the fine lines of the skin on her chest. We're going to begin by covering Amanda's eyes to protect them during the laser procedure. Again, we're going to apply a clear gel to the skin so that the Fraxel Laser will glide easily and smoothly over the skin. Again, Gabby is using the cold air blower to blow cold air at the skin, which supplements the anesthesia and makes the procedure much more comfortable. Completes our first pass, and again we're going to make multiple passes over the tissues in both vertical and horizontal directions so that everything blends evenly and uniformly. finished the treatment on the left side. We finished all our passes on the left, and now we're going to go to the right side and do the Fraxel Laser treatment on the right side of the chest. Now on the right side of Amanda's chest, and we're going to treat the right side of her chest exactly the same way we treated the left side. We're finishing the last pass on Amanda and coming to the end of the Fraxel Laser treatment of her chest. If we look at her skin, we can see that the treated skin is now pink in color, and it's very slightly puffy. This is completely normal after Fraxel, and is what we want to see when we complete a treatment. This will go away over the next 3 to 4 days. It's also completely normal for her skin to feel very warm at this point, which I'm sure it does. So we're going to put ice on the skin now and cool it down.
I like the ice packs. They help.
Okay, there you go. So
Yes!
we'll let the ice sit for about 15 minutes or so, okay?
Okay.